Shoulder podcast officially. I have with me a very special guest, not doctor yet,
Not
soon
yet.
to be doctor.
Soon to be. Hello.
Sina
How are you?
Kiamehr, soon to be medical student. So Sina's a very smart guy. He had his early start to his career, got his bachelor's in science from Harvard, and he then went on in the working world. He did some consulting for healthcare, and so he has a lot of experience in that research, conducting clinical trials. So he had a lot of experience with that, and then he decided to go into medical school.
Yes.
All right? So you just
That
took
is
your
correct.
MCAT, so you're
I know.
official now. You can be on the show.
I know. Thank
where
you.
we sit shoulder to shoulder with the experts.
There you go.
Soon to be
That was
experts.
nice fun.
Yeah.
I
All
like
right.
that.
So let's talk about it. So
Yes.
MCAT's done.
Mm-hmm.
Tell me about
Good
that.
relief.
Tell me about
That
that.
was nice. I mean, it was a
What's
very-
the MCAT? What does that even stand for? Medical college admissions test, right?
Yeah, I think medical college admissions.
So that's the
test.
big one.
Yeah,
So everybody
one-
still has to take that.
exactly.
I had to take it.
How was your experience with it?
It was hard, but you study a lot for it. And then it was different though. So your test was a little different, right? It's more writing now.
I think it has like a cars section. I don't know if you guys still had that. It's
Car?
like a cars. I think it's like comprehension reading aspect where it's not so much science focused per se.
Mhm.
It's more like humanities and sociology.
They give you a passage.
But yeah, they give you a passage, and then pretty much they're testing your comprehension of, the author, its tone, its main idea,
Yeah.
why it's using certain aspects, like what is the purpose, like what is he implying and inferring
Yeah.
and whatnot.
How long do they give you time per section like that? Like 2 hours per section, or they cut you
Yeah,
off, right? They
about-
don't let you write the whole time, and then you can't take your
Yeah.
biochemistry or something.
Yeah, so there's I think like they removed any of the writing aspects. So there's 4 sections in it, in the whole MCAT, and it's all multiple choice. So the first one is like
But
Chem
it's
Phys.
A through E or something, right? Or A through K, or they can be
Yeah, something like
a
that. It's
lot
like
of options, not just
it's
not 4
it's
or
like
5.
there's like mostly 4 options, like A B C D, but I've seen some that have like 5 options and whatnot, but they're trying to keep it like pretty standardized.
Did they trip you
Just
up?
oh yeah, they're like known for being very smart.
Well, I hope so.
Yeah, right. They're known for like understanding what are the common pitfalls of the average MCAT taker.
Well,
So-
so
Yeah.
that they were trying to trip you up.
Yes,
So,
exactly.
So did you identify it on the test?
Yeah,
when you thought
exactly.
They were, yeah.
So it's like one of the strategies that you like learn to use. It's when you're given a problem, what the idea is, that you have studied so much and seen so many practice tests that given a certain parameters, what are the common pitfalls. So when you see that on the test, you're like, I've been here before,
Right.
so I'm gonna avoid these. And then
Right.
if you see it on the options, you're like, I see what you're doing, but
Right.
not to me, maybe somebody else.
Right. Like maybe, then that happens a lot in medicine where something it's a differential diagnosis because you don't know what it is a lot of times, but you have symptoms. So you have
Right.
to start putting that together. So
Exactly.
kind of gets you thinking in that direction at least, right? It's not this, not that. Oh man, I can't tell the difference between these two, but I remember that one case, this guy got better,
Right.
and that tends to be the correct answer. But in clinical medicine, it's not always, and we don't always know exactly the mechanisms behind
Exactly.
why things work all the time in medicine, actually. It was
No.
really surprising to me once you start your clinicals.
No, 100%. I mean, that was one of the things that was very interesting to me is as I started studying more and getting more in tune of how to take the test, a lot of the times, like you said, similar to that, obviously not in the same stakes, whatsoever, but you don't know the right answer.
A lot of times, right? Yeah.
But you know what is not the correct answer.
Definitely the worst answer.
Yeah,
and-
the worst
right?
answer. So
Yeah.
you work your way up and you choose the least bad answer.
Right.
And a lot of times, and it might seem like a bulletproof strategy, but it works more often than not. It's designed that way that you're able to, even if you don't know what the right answer is, to be able to say what is definitively not the correct answer.
Sure. Yeah. I think that's useful too. And did it seem similar to your practice tests?
Oh yeah,
yeah.
it's a very hard and challenging task because there's a lot of content to cover. But once you're able to put in the hours, it's really a matter of how much time are you willing to actually dedicate to the craft.
How much time were you willing to dedicate? How much time were you per day? How much did you study?
I want to say it was a lot.
A lot, yeah, a lot can.
I mean,
for
you can attest to that.
Mortal humans.
Yes.
Yeah, you're an immortal human. You study a lot.
Yeah, exactly. I want to say like
That's good.
A normal study session realistically was like 8 hours, and I want to say effectively like what I was actively studying like 5 to 6 hours.
Yeah.
Yeah, I think I kept a log of how many practice tests that I took.
Yeah.
It came down to like 15 practice tests.
Well, each test is how long?
Each just like 7 hours.
7 hours.
Yeah,
That's
and
a long time.
230 questions total in each.
It's a lot.
So
and writing and stuff, right?
No writing. It's just the multiple choice.
Oh, I see. And those are your practice tests,
Mm-hmm.
right?
You do a lot of writings when you're doing like your personal statements and your secondaries when you're applying for medical school and whatnot.
Yeah, that makes sense.
Mm-hmm.
And you tend to you definitely tend to write in medicine because, as you know, as a scribe, that's where
professional note taker.
You came in with me. You're a professional note taker, so you have to listen and put it into words, and so that's a lot of practice there. I like writing. I've been writing by hand a lot more lately too, which is cool. Just writing down ideas and thoughts. What's that?
I bet you've been drawing as well.
Drawing, coloring.
Yeah.
Oh, I forgot to give you your gift.
Oh.
Yeah, I gotta get it. I'll get it for you later. Yeah, I made it.
Looking forward to
well,
that.
it's on that. I told you I made it for you. So,
Yeah.
But yeah, no, it's pretty cool. And one thing that I've learned lately is about the color contrast.
Right.
That's what's really helped. If you define certain lines with contrast, like black and white, a lot of times I used to draw a lot when I was a kid, but I wouldn't get into the color aspect. I would kind of stop at the pen and ink or like pencil and paper or like ink, and shading. And then I didn't color because I don't want to mess it up.
Right.
So now I just jump right in there with these. They're called Sharpie creative markers. They're awesome, and I kind of showed you how they work. But they kind of layer, like you can layer them almost like a paintbrush that dries really quickly, and so that's been really great just to.
But they're very vibrant.
Very vibrant, like the colors pop. And if you mess up, you can just go over that line again. And it's cool because there's a lot of detail with that. There's a lot of detail with surgery, with the differences in like bone quality.
Right.
And so like paying attention to that little detail of filling things in, those little details. If a screw is oriented off a little bit versus straight, that might be a difference. Even just how the case goes. So like I would sum it up to say like using like the paintbrush is just like a tool, you kind of using the oar, it's nice to be a little expressive in different ways.
No, 100%. What I want to add to that is until recently, I didn't realize how transferable some of these skills are into the field of medicine and vice versa as well. I mean, especially like specifically with jiu-jitsu as well. It's like at first sight you're like these are completely unrelated things, but when you really break it down into its fundamentals, it really comes down to how you're going to decision make under pressure, how much attention you pay to details. And the same thing with drawing is like how can you differentiate between different layers and how do you decide where to proceed from each other. There's really a lot of skills that you can learn from your everyday task.
Yeah, if you pay attention.
Yeah, if you pay attention.
Totally.
That I think. I mean, I'm not one yet, but I feel like this is where you can weigh in. Is it would kind of differentiate you as a physician, to that next level.
Yeah, I just like doing stuff that I'm into, really, and if you spend your time doing things that you like, then your days are fuller, for sure. And if you're in the OR all day, it's awesome. It's definitely great, but there's a balance to that, how much work you can do. So, I think it's good to have different interests and spend your time, kind of focusing on things that you're really into that you can grow out of.
Right.
And one thing that they want to see, especially with medical students, and this I'm sure people will listen to this that are interested in medical school, that maybe want to be an orthopedic surgeon. It's a long road for sure, but it's like the important thing that you do while you're getting to that point is the journey along the way. So it's like the friends you make, it's how you make those friends, and finding good people. You'll find a lot of really smart people, but also finding good people, and there's a lot of good people too, that are also really, really smart, which is cool. And that's really what attracted me to medicine. You find a lot of those people in medical school in your class. And so they're looking for people like that are artists, or, you might go into English and write poetry, but then you also really care about people and you're really smart and you like science too. So, there's a lot of different pathways. So to sum that up, I would say, you should definitely not give up your passions early for something that is like a job,
Right.
eventually.
Uh-huh.
It will be a job,
Uh-huh.
but like you should look at, like, it takes so long to be a surgeon. It takes even longer to be a specialist shoulder surgeon,
Right.
And then a specialist really at anything in medicine takes a long time. And then the practice of that also takes a long time to
Right.
really hone things in, years and years. So, so I would encourage you to just, you just hang on to those passions. You don't have to necessarily develop them.
Right.
You just got to keep your skills.
Just got to keep that river open.
Yeah, keep it open. Yeah, definitely. And it'll make more sense when I give you your gift. It was really great. I was really proud of it. I was just happy I finished it. But anyways, yeah, for skills, that's good. For the tests, they definitely test you on a lot of science and knowledge. Biochemistry was really, really important. Foundational concepts.
Oh, yeah.
So you're beginning that journey in medicine, because what medicine is why do I have Leonardo up there on the wall?
Right.
These guys were anatomists. They were also artists.
Yeah,
they
and
were
engineers. They're interconnected. They really
Inventors.
saw through life in a different lens.
A lot of different hats they wore. And so those guys, those Renaissance men, and those are foundational principles in medicine that when I first started that journey, I'm like, why are we talking about philosophy? We need to talk about biochemistry.
Right.
And biochemistry is so great, and you can take any of those fields as far as you want to go. So what they're teaching you is you got to know that to a certain extent, and then there's only so much time in your day, in the years, as in your training, and then eventually in your life. So there's just so many cool things that you can do, especially if you like science and you like the arts. That's really what medicine's about. You got to be somebody that kind of likes both of those things.
Right.
Otherwise, you're a scientist. That's cool. You go into science, that's fine. But you're not going to be, somebody who's really in clinical medicine for a long time. At least you'll get burned out.
Right. It's very clear, and I'm glad that you're touching up on it. I don't think there has been enough talk about what you need to prepare yourself to become a successful practitioner.
Good idea.
And what you can prepare yourself for the longevity of the journey.
Good idea.
You mentioned.
Great idea. I think that's a great idea. I was just having that idea today. And what was interesting is, I'm 6 years in my own practice, or 6 years into practice.
Right.
That's after training. And in training, I was in training for 5 years,
right.
6 years, where you're working as a surgeon. So that's 6 plus 6 is 12 years. So I've been doing that for a long time. And you put your head down, you're learning all that stuff, and you're doing really cool things, and you're helping a lot of people. But if you don't have that mission in your head or in your heart early on, you might kind of sway off and try to figure out what the heck you're really doing. So I think having an idea of really how you want your career to play out, we've definitely talked about that.
Yes.
You know, and that's a really good thing, because it's not, like I said, it's not about that, oh, I've attained it. I've gotten the house, I've gotten the whatever, I got that job, boom, I'm done.
Right.
It's like, no, that's just the target I'm aiming for, and it's definitely good to have a real detailed target.
And a temporary target at that.
Definitely.
The real goal lies behind it.
Yeah. And sometimes people really want to be a chairman, and you got to really want that goal and then stick to that goal. But if you don't want to be a chairman, you kind of make your way to that, and it's not something you want to do. It's okay to say no. You might be somebody that just doesn't really like that, to fill those shoes too. So keep that in mind too. You can shoot for the stars early. And I see that in you, but it depends where your targets are. So just keep that in mind. You got to do what's important for you, and whatever that means, but just make that decision early, because the journey gets going, and man, you keep running on that track for a while, a lot of years, but it's awesome. I don't regret a day of it. It's awesome.
I completely agree.
Now I get to talk to young bright minds like yourself.
now you get to lead. Now you're on the other side of it.
Yeah, we get to teach each other stuff. So let's talk about some cool stuff.
Yeah.
So we want to talk about some topics. One big topic. I get a lot of questions. In this show, I like talking about things that patients bring up. I like to have patients on. People who've gone through the journey themselves. Right. So one big topic is peptides. I get a lot of questions on that. Peptides we can talk about the basic structure of them.
Yeah.
They're basically amino acids that combine
pretty much
in multiple different ways. You can give the scientific perspective on that.
Of course.
But just from the clinical perspective, peptides are stimulatory molecules. And so they're being used. They're not, as far as I'm concerned, used and prescribed by doctors because of regulatory
Exactly.
concerns.
Mm-hmm.
And I just am interested in knowing more about them because I know they're widely used, and I'd like to know a little bit more about some of the literature behind that. So I know there's not a lot of human studies on them, right? We're
There's
looking
very
that
limited.
up. Very limited. So
Yeah.
let's talk about that.
No, yeah, 100%. I think that's a great segue. So, like you mentioned, peptides are pretty much proteins, but there are short chains of proteins. So there are proteins with less than 50 amino acids.
Okay.
You call them peptides. And
So amino acids are they attach to each other.
yes, they are the single building units of proteins, and like you said, they attach to each other. I mean, we don't need to get into the specific with like the amide bind, with
Yeah, like how they're attached.
Yeah,
they're chemical bonds.
yeah, they're chemical bonds, and as the chain grows, obviously your peptide grows and goes into longer, and it's not really like the conversation of a length thing, but more of a functionality. And what they serve, at least in the human body, these short chains of amino acids, they're, as you said, expressors, or more commonly known as like signaling molecule. In the sense that once you inject them in your body, or you ingest them, or whatever it is that you get these peptides, and your body also does generate some sort of peptides. And what they do is that these peptides bind to receptors onto the cell surface of your cells, and what that does is that it initiates a intracellular cascade of signaling. So it binds to the cell and it tells the cell to basically do these certain tasks.
Mm-hmm.
And more commonly than not, these tasks are regarding like DNA regulation, transcription, in terms of making new proteins and making new factors and whatnot.
So basically, your body makes them to turn things on in
Exactly.
certain cells when it needs to.
Mm-hmm. It can turn stuff on and turn stuff off, but more common than not, it just turns it on. They're regulators.
Okay.
And
so they're amino acids, which we have essential and non-essential in our body, and we need them in our diet every day, essential.
Exactly.
And then we can make the non-essential ones in our liver. We can recreate them, change them around.
So
we can basically make peptides
100%.
on our own endogenously.
Yes.
We need to. We make them from our diet.
So that's pretty much how it works.
Right.
Basically, how these peptides have been made is that there has been pathways. And as you know, you have, like your angiogenesis pathway, you have your growth pathway, you have your inflammation pathway, and all these different stuff where it's the same blueprint of some sort of this peptide binds to a receptor. It causes this regulation within the cell. The cell produces these factors, and then they have these effects. So what these peptides that now have become very popular, that people like use, especially in sports and regenerative in sports medicine, is they have made a synthetic analog of these peptides, and you are pretty much kind of synthetically upregulating that pathway. So like if your body, like for example, in specific like BPC 157, which is used for ligament healing and they call it accelerated healing, the pathway that it works on, it already works every day in your body. What it does, it kind of like turns on that the level of, okay, now do this more. And obviously with doing that, we're going to talk about this more in detail. It's not as simple as just opening that up. Like, what this peptide does on the macro level, but you don't know what other smaller mechanisms it's going to affect. And
of course.
What
and
is
at what
that?
doses,
Yes.
and which tissues at which doses.
Exactly.
And for how long. And so I think a lot of those determinations have been made based upon animal studies so far, right?
Yeah. So as I was looking at it, so just to give a little bit of background, as you mentioned, I did a lot of research. So I think that I did 6 years of research, 2 years at like USC School of Pharmacy, and then I did 4 years at Harvard when I got my bachelor's.
Oh yeah, you went back to Harvard to do research, or
it was concurrent. Yeah, while I was
there,
I was doing the research, and I did similar stuff. So when I was at School of Pharmacy, I basically we were looking at the role of human gut microbiome in affecting alcohol use disorder. So like we know different people have different tendencies for alcohol use disorder, but we were trying to see what is the role of the makeup of your gut microbiome of, you have different bacteria in your gut, I have different bacteria microbiome.
Yeah.
And how does that affect? And then when I was at Harvard, we basically looked at, again, effects of the gut microbiome in terms of modulating neurotransmitter levels, like they called catecholamines, in terms
Okay.
of dopamine, norepinephrine, other peptide hormones. And so
That was a study that you did?
yes, we did a couple of those studies. So we were basically finding how are these bacteria using these neurotransmitters, and the pretty much like the backstory about that was, if you imagine patients with Parkinson's, one of the main reasons why they develop these symptoms is deficiency in their dopamine.
Okay.
And how you treat this now is you administer levodopa or L-dopa, which is a precursor to dopamine.
Okay.
And the issue that rises is that the patients, quote unquote, develop a tolerance to levodopa. You need to increase the dosage as the treatment goes by.
Right.
And we found one of the reasons for it, it's not that the patient is more resistant, is that it gives a growth advantage to the gut microbiome that can metabolize the L-dopa. So the more you give the patient the L-dopa, the bacteria eat it more, and they bring down the bioavailability of it by like 80%.
Mm-hmm.
So most of it doesn't even get to the patient. It gets to that.
Okay.
The reason I bring it up is to say, how complex these pathways are.
Mm-hmm.
When obviously different pathway, but similar concept is, it's not as simple as, okay, we're going to inject somebody with this compound. We know the end point of this compound, so it's going to do this.
Mm-hmm.
Before it gets to that end compound, that molecule will have an effect on, multiple and various different cells and tissues and different pathways until it gets to that end point.
Yeah.
So it's very important to have, to not just look at a few rhetorical studies or some few case studies
Mm-hmm.
and say this works. You need, obviously, as you know, very large randomized human studies.
Well, at least some.
Or enough to make us
Enough to
confident
make a
in it.
decision.
For like BPC 157, I know that's the most popular one.
Right.
There really hasn't been, I think there's like one or two, and they're very recent, like they're 2022. The sample sizes of these studies are very small. It's
What were those
16
studies?
people.
Do you have the?
If I have to pull up the specific one on this.
Did your study look at any peptides?
No, it's just we looked at neurotransmitters.
Neurotransmitters.
So norepinephrine, epinephrine, dopamine, basically anything.
Peptides can be neurotransmitters, or I know it's
they
amino
can be.
acids. They can be.
Yeah, so it's more amino acids.
Glutamine, I know, is one. That's an
Exactly.
amino acid.
They can be. So pretty much the difference between, I might be wrong on this. The difference between like a neurotransmitter and like like a hormone is, neurotransmitter specifically like acts on the synapses of neurons.
Yeah, it's local.
Yeah, versus the hormone goes on different tissues and acts on the. It's more like a semantic thing.
We'll have to have a neurosurgeon on. He can talk about that.
That would be cool.
We need to have Joel Beckett on.
Oh, that would be amazing.
He'd be great.
We should do that.
Yeah, he's a smart guy. He would know all about those synapses.
All about them synapses. So on the specific one, there has been a retrospective study of 12 patients. So this study just looked at 12 patients with chronic knee pain and then found that 7 subjects reported relief for more than 6 months following a single injection.
So pain relief.
Yeah,
Did
pain
they
relief.
do any imaging on them? Was there any objective, like were they?
I have to look into that. I don't think there
all?
has been any objective releases, and then there has been like.
I mean,
case
that alone,
series.
if they had knee pain and even if they had arthritis with a 6-month outcome on pain, and they didn't have any imaging findings that showed any difference. I mean, I don't know what you would expect. How did they inject them? Did they inject their knee or did they inject them muscularly? How did they
intra-articular injection.
Really? So they injected in their knee.
Mm-hmm.
Okay. So they are injecting it.
Yeah.
So,
but the main issue, so even though
that's not FDA approved.
Absolutely not.
Yeah.
It's too small, too early. Like these things they have shown very small, very strong animal model efficacy, but like I said, it needs to be tested in very more patients with varying conditions to make that decision.
Right.
And the reason why there has been we are especially cautious about BPC 157 is because of the known pathway that it acts on. So it basically stimulates or upregulates the VEGF pathway.
What is
And,
VEGF?
So VEGF
That's
pathway is
vascular, right?
Yes, it's vascular. So it's for angiogenesis and basically
Vascular endothelial
Yeah.
growth factor, I think.
exactly.
Yeah.
So very nice.
Yeah.
And basically what they do is this pathway stimulates capillary growth.
Right.
And one of the main concerns with that is that's kind of the same pattern you see with tumorigenesis and cancerous
formation.
tissue, cancer
Mhm.
formation. You do see these upregulations of VEGF. So there's especially that cautious form of like, we need to be, we need to see the data before we can prescribe this to our large population.
I just looked up BBC 157 and other orally or injected exogenous peptides. Says regulatory risk, not FDA approved for any medical indication. It is commonly sold as a research chemical. FDA specifically flags certain bulk substances used in compounding as potentially posing significant safety risk. Category 2 list. This matters because people obtain BBC 137 via compounding gray market routines where purity, sterility, and dosing accuracy can't be assumed.
Oh, that's another thing.
So you don't know if it's pure or not.
Yeah,
you know.
purity and contamination is a very big risk because, like you said, it's not FDA approved. They don't have a controlled, regulated way of getting these compounds to people. So
if the question is what are you injecting,
mm-hmm.
and you don't know exactly, then
I don't want to do that.
I'm not doing it. So I don't know who's doing it.
Right.
But if a doctor's not doing it, then I think it's highly questionable.
Mm-hmm.
So what about oral? Do we know about oral?
In terms of oral, it is a good pathway. The reason why is BPC 157. They the first time they isolated it was from gastric juices, so it is stable in acidic environment. So oral is a viable option.
Just not going to work as well, probably.
Yeah. I mean, we barely have the data for 12 people with the injections. So again.
Yeah. So why this matters for peptides to influence inflammation, angiogenesis, which is we said capillary growth, new blood vessels, tumorigenesis. Growth signaling, healing pathways. A common theoretical concern is unintended effects of abnormal tissue growth like tumors or immune effects, not because we know this happens in humans with this one, which because it hasn't been studied enough. So that's why those are important. But like if it's unregulated, then you can't even start those trials. So I think that's where we are, is the fact that it's still so unregulated and that there maybe has a lot of good potential benefits. If it's unregulated, you can't really study it, you know. And so I think the next steps with the peptides are going to be some type of standardization, you know, and then looking at the safety profile in small controlled studies. Actually, you know, you got to start with smaller studies to make sure it's safe. Right. Before then, it's the phases of the clinical trials are expanded.
Yeah, you probably need like a phase 1 or phase 2 just assess the pharmacokinetics. Well,
phase 1's in animals, so phase 1, but you would need to do phase 1 in something that is standardized. Right. You know, so once you get there, you got to start. You know, that's where you start. So I think there's a lot of. Sounds like a lot of promise, maybe also a lot of risk, you know, and that's where it becomes real tricky because certain medications, I mean, there was Vioxx. Vioxx was an awesome medication that then, you know, caused some problems and people got blood clots from it because it had also potential harmful side effects, right? And so, you know, it can cause something that's really good, but then harmful side effects as a side effect. That's what side effects are, and that's why studies are important, and that's why looking at things objectively before we just start using them, we have to study them. You know, you can use them, you know, through regulation. Look, not everything is FDA approved for every indication, right? You know this. BMAC? Yeah, those are major things. And by definition, you can't promote them. Right. You can't promote even procedures that are not approved by the FDA. You can do them and you can report them, obviously, because you got to do what's best for your patient. No, 100%. And so that's the line that we write, and that's why it's so important to really try to get the right answer. And also, you got to tell your patients, you got to inform them that it's off label, and so off label is fine. It means it's a little bit longer conversation, so they understand what that means. And what off label really means is if something is FDA approved, then it's gone through that stringent process.
Right.
But it may be not indicated for everything. So then it's technically off label. It's like a drug that works really well also to make you sleep, and it's not that harmful. So it's used off label to make you sleep. There's definitely medications like that. Same thing is true about procedures that we do. Getting bone marrow and putting it in different places in your body in concentrated form. That's awesome. That's really great stuff. It works really well and it really does heal, but there's not enough stringent studies on it. So something like BMAC is very similar, but it's definitely, I would consider, safer.
Oh, 100%. The reason why I would say that is, obviously, procedures like BMAC and PRP, as you have taught me, they're autologous. So you're using the patient's own tissue or own factors.
Absolutely,
to stimulate that desired healing effect.
Right.
Versus when you are so that's not really meddling with the regulatory factors at work with the patient's body, but
it may,
but
that's why it's been studied, and you look at these safety profiles for a long time.
Yes, and that's why it's FDA approved for a different indication, knowing that it's safety, and I want to touch up on that as well. But the difference with these synthetic peptides is when you are administering exogenous factors into the patient, you are like actively trying to upregulate that pathway and change that pathway, which I think from like at least a theoretical standpoint, it has higher risk than other procedures like PRP and BMAC.
Yeah.
And the other thing is,
I think that's a reasonable statement. And when you don't know the proper levels and the tissue response, and then get a good idea, usually with imaging, we really need imaging on those studies, and so we need ultrasound or some type of soft tissue imaging in those studies. Also, using peptides. So.
And another distinction that I want to make is when they say that something is FDA approval, really in terms of those studies, means that compound is safe for the most part to be used for that indication. But also there's different levels that the compound has to pass through to get that FDA approval. And the first step is showing the lack of toxicity and the safety of that compound for the patient. And then after that, in the latest phases, you are showing that this new compound for that specific indication is doing better than a head-to-head of either a control patient or a patient on a already approved medication for that indication.
Yeah, randomized clinical or controlled trial. Right?
Exactly.
Randomized
So
controlled trial. That's phase 3.
Exactly. So I think it's like very helpful for people who are not really like scientists to understand that. It's like when you're saying that something is, off label, it means that it has been tested by the FDA, that it is, it's like safe to administer.
Well, and so do you know what phase 4 is then?
I think phase 4 is longitudinal study to...
No, it's post-market surveillance.
Yeah, post-market to see after like 10, 20 years of like what are
longitudinal. Okay,
longitudinal study of like PROs and like...
But that means it's on the market and you're still studying it.
Yes.
So that's basically where we are with a lot of these FDA approved and not necessarily on label for every indication. There's ongoing studies on those.
Yeah, exactly.
Yeah.
But the point being is that peptides are not even past the first level of like,
you got to look at safety. Yeah.
Yes.
So it's got to get past safety.
I think a really good example was an analogy that I think it's going to make a lot of sense is administering these peptides is like playing with a very complex machine. You know what the main lever does in terms of pulling it down and up, in terms of like upregulating or suppressing a certain pathway, but you don't know by moving that lever what are many other components that you are changing and what are the many effects within the complex machine.
Sure. Yeah. Well, that's very well said. The field of immunohistochemistry is a pretty cool field. I'm learning a lot about. There's different ways that they can actually take genes like mRNA viruses, basically, or they take mRNA itself, and they can turn a gene on for a couple weeks in a mouse, and then get the VEGF to stimulate, and then
Mm-hmm.
it exits. So it's basically like a codon, I think.
Right.
And so they can splice it in and splice it out, and the animal
Mm-hmm.
survives. Pretty cool stuff. But then they can use them, that mRNA technology, in different ways for animals. And then, where does that go? So that's kind of what you're talking about too, but how those fields interact, like immunohistochemistry, but then using exogenous different types of medications. Those are almost two separate fields. And I think both of them can be potentially very dangerous, in different ways, but also they could really, really help people and really change a lot of problems. So we still have to look at them.
Right.
We always have to keep our eyes open as scientists.
No, especially with these, I think they do grant a certain level of attention, especially when they become so popular.
I just keep hearing about them. My
Because-
patients keep asking me almost every week now. Who's talking about them so much? Who is it? Who's talking about them?
Mostly,
Who's the hip, cool kid talking about peptides these days? Because, man,
it's mostly jiu-jitsu practitioners because they're the one who get hurt the most. They need that stuff.
well, definitely jujitsu
But
guys.
it's very heavily marketed to athletes, and the reason for the appeal is the appeal of precision medicine.
Yeah.
Because it is on the blueprint of it. It has plausibility. It has scientific plausibility, because you know exactly where this peptide goes, and you know exactly what receptor it attaches to, and you know exactly what pathway it modulates. Right. So that's why it has, in my opinion, has gotten so much attention, especially with the recent decades of hype in precision medicine. And in particular, I think it got the attention of athletes because it is, at least on paper, it is promising very accelerated recovery.
And I think that's pretty profound, and that does make sense that you say that. I think that probably is the reason, and maybe where the future is going to go with peptides is figuring out, we need to figure out how the effect is modulated in the body to a certain extent of getting that effect with
Right.
that peptide at a certain level, and then using it at that level to then study the effect, right?
Right.
But I think what you said was, with precision medicine, that totally makes sense, especially with recovery,
Right.
all the stuff I'm doing with the cold plunge,
Mhm.
like people talk about like the timing of when you should do that, how often, like, so really dialing in the recovery for athletes to avoid injury,
Mhm.
so if you can use them, even, people talk about like using exogenous growth hormone and testosterone to build muscle. It's like, well,
Oh, yeah.
it will build muscle and it will protect you, from injuries in certain ways by having more muscle in those
Right.
areas, but you also might get a tumor or cancer,
Right.
right? So there's that balance. So I think you're probably onto something, same thing with like testosterone replacement, so it's like precision medicine is a
There's
good
a
way to
lot.
put it.
I've also
Yeah.
seen a lot with hormone therapy for menopausal women recently, because I know there has been some estrogen replacement therapy back in the day. I think the data was not conclusive, but it kind of pointed to the way of it might be at risk of tumor genesis. I might be wrong on this, but
No, I know exactly
but
what
yeah,
you're referring to.
pretty much it was decided by the medical. It was like a group
I
thing.
don't remember the medication, but there's was it a contraceptive?
I think so. It was something in
You'll
those
learn it in
scenes.
medical school
Yeah.
in your OB-GYN
Soon.
section.
I'll be there. Don't worry
Yeah.
about it.
You'll learn that
But-
again.
But pretty much, it was decided back in the time with the limited data that it is not safe. So you should they should stay away from it. But now I think this is like a recent year development. It was last year that they've kind of looked at new data, and they are like, actually, it's not that unsafe, and it can actually be used, and it has profound benefits.
Yeah.
The point being, you need more data, and even when you think you have enough data to make a decision, you need even more data to be
Well,
sure.
We're in the information age, so I think the research we're doing in the office is good. I think it's good to do research. We got to know more. It takes time to learn about humans. We got to
Right.
do more studies on humans. I'm very pro-human. I treat humans. I make them better. Hopefully, they come to me with their
Right.
problems, and I try to fix them. But a lot of their problems they want to know. Excuse
Bless
me.
you.
A lot of their problems, they want to know, how do I optimize my healing?
Right.
Is there anything I can do? That's why they ask me about peptides a lot of times. We try to stay away from alcohol, too much of it, but it's like we advise them on the bad and say what's okay, and then what will help. you
Right.
know, and then they got to decide. They got to go do it. People that are, you know, going to guys who are injecting peptides, I mean, that's their decision, but I still won't necessarily recommend it right now, depending on, you know, where it's coming from.
Mhm.
Maybe there will be a good company that's acceptable.
Yes.
You know, and
I think
there's enough data on it.
from
And then maybe I will make a decision to change that.
no,
right?
100%. I mean, at the end of the day, I think it's like you said, it's up to the human to decide if they want to use it or not.
Right.
But from my humble opinion, I would say, if you can, wait on more data. If you really want to do it,
Well said.
what you need to make sure to do is to get it from a source that you can be sure of its purity and lack of contamination. And even when you do find that source that's able to sell you that under, you know, research compounds, it's very worthwhile sending it to a third-party laboratory in terms of testing its purity and if it really is what they tell you it is.
That's going to be the next step is just a third party testing. Yeah, for sure.
I mean, for the bare
purity.
minimum,
Yeah.
at least you want to know what's in there.
Yeah, for sure. Well, you know, we're going to take a little segue here on the LA Shoulder podcast because I have a
Look at
new
that,
sponsor
baby.
on the show and a very special friend. Shout out to one of my very special sponsors. So thank you for the nice bottle of Mandala Tequila, Dia de los Muertos, special edition. We're going to taste it tonight on the show. So
Amazing.
Thank you to him and his lovely wife for being a fan on the show, for telling his friends to subscribe, and for supporting the show. So
Thank you,
we
guys.
will definitely keep more fun content and educational content coming on the LA Shoulder podcast.
This is
Can
exciting.
you open that for me, Mr. Bear? I can't get that thing open. I had a rock in the backyard that I had to move, and I was like, Sina, I waited for Sina. And when I had to move this giant rock, he just moved it right up the hill for me. He's a strong bear. Here, pour some for yourself in my. Oh, yeah. Make sure
God.
that nice pours on the microphone. Oh, yeah. Sounds wonderful.
Let them hear it.
It just sounds better. Like, mandala sounds better when you pour it. Listen. It's just,
Oh, God.
It's just the smoothest sounding tequila there is. Especially the Dia de los Muertos. We're just past it, but yeah, don't cork it too tight. Cheers, buddy.
Cheers, buddy.
Thanks for coming
Thank
on
you.
the show.
Thank you for having me. It's been a pleasure.
So, what do you think the biggest misconception in the pre-medical student world is? Like, what do you think the biggest piece of advice, not coming from you, but like, you know, now that you've taken the big test, you know, you got to go through the
Right.
process. What do you think the biggest misconception that you hear, like word on the street is, or people are talking about, like that you think they might be a little off on, that you figured out about medical school?
I think the biggest misconception that, I mean, there's a lot.
Yeah, exactly. People say a lot of crazy shit.
They say a lot of crazy shit when
Especially
it's
in that world.
unregulated, you know?
I went to UCLA, man. Everybody
How
was
was that?
pre-med. Everybody was wild pre-med. They're just like, hey man, you gotta do this, you gotta do that, you gotta have so-and-so write you a letter.
Mhm.
That's really important. You know, you gotta do this on your test or you're not gonna get in. These are misconceptions.
Right.
But it was just like, put your head down and I'm gonna
Right.
apply and do it. Because I just had this I don't know, like my will was so strong. And I just knew, I was like, I'm just going to do it.
Right.
My scores are good enough. My GPA is really good. And I don't know how much more I can learn in college. I really want to go to medical school to learn that stuff, to learn doctor stuff.
No,
So,
100%. I think the biggest misconception is the phenomenon that you just described, in a sense that people think they can formalize the success to getting into medical school. I think now that I've a little bit more wisdom compared to my 21-year-old self and a little bit more experience, I think the most important thing is to show competency and to show qualification for medical school. And not just in terms of, I have this GPA, I have this score, and I have this experience, but really through your resume, showing that I am the type of person that I'm able to handle the pressure that the medical school is going to throw at me. I have a inherent ability to be able to want to learn and excited about this topics, and I understand the reality beyond the romanticized ideology of medical medicine and medical school, that I understand what I'm signing up for. I also am able to get through the process and not quit and waste your resources. And by extension of that, I will be able to give back once this much time and effort has been invested on me back to the medical field. So I think if you approach it from that perspective, you might have a much stronger application versus a person who's like, okay, I'm going to do this for 6 months to add this to my resume, and then I'm going to study for this.
That's
and
a
then
big one.
I'm going to like do this for 6 months.
That's the one that starts creeping in the back of your mind.
Yeah.
Right?
So then I can have this and that.
Yeah.
I'm like, I think, like you said, is in the beginning of the podcast,
I haven't done enough.
Yeah.
Right.
It's like, I haven't done enough. It's like, no, look at what you're good at and look at what you are interested in, and look at how they are connected in helping you develop as a person and an aspiring physician, and keep developing those certain skills. I think
well, a lot of people wash out.
Yeah.
You know, and there's a high attrition rate.
I think there's two things. It's high attrition rate. People drive themselves too thin and they want to try too many stuff. And the second thing is that I think you come off as ingenuine. Like it's impossible for you to be like interested in research.
Exactly.
And want to do this and then want to do that and then want to do all this stuff. I feel like if you're like a 50-year-old, 60-year-old admissions officer seeing medical applicants year after year,
you've seen it
look
all.
at it.
You've seen everybody coming through your desk. You've seen everything has come across your desk.
I think being genuine, like genuinely interested.
Right.
Obviously, some facts remain. Study hard and high score, and that.
Well, that's how you get in.
Yeah, and that is to show that I can take it. I can get this information. I can not only like memorize stuff, I can recall stuff, and I can actually pick up what you're putting down.
Well, yeah, you're smart, you're quick, but you're also, you're a solid dude. You're a solid guy. And I think you have a good head on your shoulders. And that's pretty much what, every other, so-and-so wants to come and get some experience in the office, and it's fine. But, you hung around and I saw you as very valuable, to what I'm doing. And that's really good if I see somebody valuable, because otherwise if somebody like yourself is not valuable, then why are you wasting your time with me, in the office? Because that's a waste of both of our time then. So that's really good. So if you can be somebody of value, that's a big deal. Because then you can, that's value in itself. Like you have value. And especially somebody who's rising, that's really important to know where you are in that hierarchy, I guess, right? Because like there is a hierarchy, and like you have to understand that, especially in orthopedic surgery. It's a little militant at times, right? Because it's kind of like there's potentially major issues going on, like severe, urgent, critical patients, or there could be, people dying potentially, trauma situations. Patients, obviously, if you're on the trauma call, but that's, that's real stuff. So you guys just got to be ready for that. But, what I find is that, in that field is really great. There's awesome people. And you kind of find if you fit in well, but also I found that like, if you were to ask me the biggest misconception, I would say that the lack of humility, is important, right? Like the importance of lack of humility. Just let that settle for a second. Like if you're not humble, like you're a real, like I'm playing you up and talking you up because I believe it, but also you're a really humble guy. So I can beat up on you and like you just take it and you kind of look at things. You're like, no, I mean, either I'm doing the wrong thing and I can learn and get better, or that guy doesn't know what he's talking about. Yeah. Right. One of those two things. But like being humble is really important, and the value of that, especially going on, because you're with so many stellar achievers that I went through that. A lot of cool things too, and they're really talented, and they might have ego problems, know, and so you have to be humble going through that whole process. That will get you far too. And when you're at the top, hopefully you're a humble guy so that you're a nice guy and you stay that way. So it's always good to be humble.
Give back.
Yeah. Good. It's a good virtue.
I think what you said is very important. And
I hope so.
Not
if I said it, I would think it is. I hope. I don't like to say dumb things.
The reason that's funny. The reason why I say it is, I mean, what really resonated with me is when you said in terms of adding value, and there's a couple of things that I want to touch up on that. It's per our conversation like 2-3 weeks ago, I think it's very important people read 48 Laws of Power.
That's a good book. Robert Greene.
Yeah, I really enjoyed that book.
Yeah,
that was
good.
really cool, especially because
Pretty dense, with all the old stories and stuff. Kind of jumps around.
I really liked all of the old examples.
It's great.
It was very cool.
Yeah.
I think, yes, understanding that there is a hierarchy at work, and as smart as you think you are, and as smart as you might truly be, there have been people who are like not only smarter, but have put in more time in this than you, so they know more by experience. And the
They're
fact
black
that
belts.
yeah,
There's a lot of black belts out there.
There are a lot of black belts in medicine,
Yeah.
and you need to be able to have confidence, but not let that confidence get into cockiness, and more importantly, not let that ego get in the way of your learning, of when someone's telling you something.
Right. There's good students and there's good learners and there's good teachers.
Exactly.
And then sometimes there's both. If you have a good learner, a good teacher, you're going to have an awesome learning situation.
Yeah.
A good teacher will teach a bad student something.
Right.
And a good learner will learn at least something from a bad teacher, right? They can learn something.
It's not
from
optimized.
It's not optimized.
Yeah. And the other thing is, going off of that, is when you are trying to put yourself in those situations as someone who's trying to learn, it's very important to see, okay, I'm getting something out of this in terms of learning something, but what incentivizes my teacher to teaching me? Like you said, you have to be able to add value to that person in some way.
It helps.
Obviously, you cannot match the value that they give you,
Right.
but the sheer fact that you're trying to some portion, trying to be useful to them, it really helps.
But what you just said, that may not be true.
Yes,
It may not
exactly.
be true. Sometimes young people can offer more value than they're offered, and that can be the situation in some corporations,
Right.
On the rise to the top, where you're doing all the work as a young guy, and then they're dangling the carrot, and you just make your way slowly across fields, like this guy. No, so you're talking about yourself
With like consulting stuff.
Yeah, I'm sure. Like that world, it's not always what it seems at face value. I think that's what you got to learn through the school of hard knocks, is that things aren't always what they appear to be at face value. And so you can learn that, but you don't necessarily learn that through medical school, just like learning that through your teachers, because it's school still, it's like you're learning from people that hopefully care about you doing well. And you should be able to trust them because the patients trust them, so you should trust them, that kind of thing. So, and that's why medical school is great, and going into medicine was great, and the medical field is still awesome. Doctors are still great people in general, I find.
No, 100%. Because I think it takes a certain type of personality to be able to willingly sign up for that many years of training and that many years of hardship to really give back to community. So I've found, like 80% of physicians I meet, super cool people.
Yeah, well, you're nice too, so hopefully that you attract other people like that.
but no, the funniest thing is when I tell people, and I've gotten this reaction like 4 times already, every time I tell people how I met you, people are like, this is the craziest thing.
How'd you meet me? Jiu-jitsu, right?
Yes, jiu-jitsu.
Yeah. How was it? We rolled together.
Yeah,
we rolled together for a long time before I ever met you.
Well, I was a little shy, and then you
were a white belt.
I was a white belt.
You're blue belt now.
Yes.
You're soon to be purple.
Soon.
Edwin's promoting people left and right, so I'm sure if you show up, he'll give you your belt soon.
No, that was
no, but you're really good though. I'm not.
I'm trying.
Around. You're right there at a purple belt.
It's because I rolled with people like you who like teach me the stuff. Like
but you take really a lot of initiative too to your training. Like you're very focused, right? And you've been studying for your medical school test, but you're also showing up to the office. You're also training jiu-jitsu. You show up to your family. Like you're doing a lot of things.
Yeah.
So it's good. But you seem to learn jiu-jitsu quickly.
Yeah,
which is kind of scary because I'm not learning as quickly. You're like half my age. You're gonna be a lot better than me quick. So I gotta watch out.
He's like, I gotta stop teaching him stuff.
It was funny, like when I was It was like 2 years ago, maybe 2.5 years ago. And you start to get old quick as you get near 40. So I was still high in prime, right? And I was a blue belt. So I was going against this older gentleman, let's say mid-age 40s, black belt. God. And I was schooling this guy and I was like, I thought all black belts were, it's like, well, the guy knows jujitsu though. He still knows jujitsu. It's just, he doesn't want to mess with you today that much, right? You're just this young, strong, crazy guy.
Yeah.
So that's that perspective, that humility, like, don't be that guy beating up on, I'm this big, strong guy now. It's like, well, maybe just to that guy in that day. That's it.
I have recently learned that.
Yeah.
And I still have ways to go to learn that.
You learn that on the mats?
On the mats, yeah. In terms of, being that, I know it's crazy saying it out loud, that you're like, how did this kid not realize this earlier? That not everybody goes 100% every role that they do.
That's true.
Right?
I've learned that. It's taken me years to learn that.
I have not learned.
Like, why is everybody always so mad at me?
Yeah. Because
they're not always going 100% all the time. Calm down, kid.
Literally.
Right?
Because I mean, you know me, like we've worked.
That's your humility.
A long time.
That's your being humble, and that's it. Just the more you roll like that, the better you get. Actually.
Yeah.
Yeah.
So my point is like, just
slows
recently,
you down.
Yeah, I've gotten to the point is like, you gotta like match people's energy. Like you can't go 100%. But that's just who I was.
Who goes the hardest? It's the young guys usually.
Yeah.
Or it could be anybody though. You never know. You just never know.
I want to say this. You know what really agitated me when I rolled with you when I was a white belt? The fact that you didn't put in any effort and then you like tap people out left and right.
That's not true.
I have to say this. When I was a white belt, you were a menace.
Well, because you never know. You just never know.
Because I would get him put in like reverse triangle, and then like as I was getting like choked out, I would look up to be like, what is this monster wrapping his legs around me? And you were just like,
I was working on some stuff.
Just like random thing.
I don't even remember how to do a reverse triangle anymore, because you learn new things and you're like, it's been so long, I got to remember that one. But
who goes the hardest?
That's why people keep training forever. They're just going to be black belts and just keep training.
Just keep training
forever.
New stuff.
Yeah.
I think you're the person, you roll more like Eddie, the black belt, in the sense that you are like, you conserve energy. And
that's a big compliment, because Eddie is a monster.
He's pretty good.
He's the octopus monster.
You seem very composed when you do your magic and then you just like crumble people up. I roll more like somebody like Carlo, the purple belt now.
He's good. Carlo's really good.
Where it's like, I'm just like bang, 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 bang.
Is
like
it Carl 100%. Or Carlo?
I always call him Carlo.
Oh, I thought it was Carl. I'll call him Carl.
Maybe I'm wrong.
I'm going to say Carlo and see what he says.
Yeah. I mean, Carlo is just rolls off the thing. Yeah.
Rolls off the tongue.
Rolls off the tongue. He goes really hard. I enjoy going with him because he matches my energy and then some.
Are there any other doctors? There's another orthopedic surgeon that rolls?
There's a brown belt.
Yeah, he's brown belt, right?
I rolled with him once. He's super nice, super technical.
Really good.
And
really good.
Yeah, he's really good. Like in the middle of like...
I think he's in Ventura. I should have him on the show. He'd be good on the show.
Oh, he'd be amazing.
Yeah, I should definitely have him on the show.
I've seen him show up in scrubs and then literally shows up in scrubs.
What's his... Do you remember his name? It's not Gene. I can't remember his first name.
It did have a J. I don't remember it.
Yeah.
James? No, I'm not sure.
I'll hit him up next time I see him. Yeah, he's a really cool dude. That's funny about jiu-jitsu. You know people for so long, and it takes about a year to remember their names. You have to see them like every day for a year. Is anybody else in medicine or Jessie? Jessie's dad. She's in the medical field. I work with her dad. He's a pretty famous hand surgeon. Really, really cool guy. And he doesn't train at all, but Jessie trains. Her husband doesn't train.
What is interesting is the demographic of people who have been doing jiu-jitsu has been very different what I've imagined and what has been in reality. And I've actually had this conversation with one of my friends recently of why is it that so many lawyers and doctors and physicians and business owners and type of demographics are so
I see a
gravitated.
Lot of independent people.
Yeah.
A lot of you said business owners.
Yeah, a lot of business owners, a lot of physicians, a lot of lawyers, a lot of engineers.
Especially at noon. They all train at noon.
Yeah.
Because then they're taking their lunch
in between
break.
their lunch breaks. Yeah. And I really think it's the dynamic problem solving aspect of jiu-jitsu that really attracts these type of people. That, you know, it does I think from the outside it looks like a lot of strength and a lot of aggression and violence, but once you and I think that's true to a certain degree when you're a white belt, but as you like climb through the ranks, it's you understand the intelligence factor behind it, and how heavily that weighs in your roles, and in how you can dictate your interaction when you spar.
Yeah, it can be. You know, I think people get attracted to things for different reasons, you know, especially jiu-jitsu is so complex.
Right.
And you know, you talk to Edwin about all the different reasons why people sign up. But it's definitely awesome. And it can be whatever you want it to be, especially like more of a mental game, and, you know, less physical or more physical. You just, you know, you kind of have to find the people that you vibe with.
I know you box as well. What has gotten you to focus on jiu-jitsu and really attract you to jiu-jitsu?
I mean, I would say I'm learning boxing, but it's all part of it. You know, it's really, what I didn't understand is I was just so helpless when I started. I got into it because I just heard about it, and, you know, I just didn't really know what it was. So I just went and did like a noon class, and I found out, and I learned from a lot of purple belts, and like the professor wasn't even there, but it just kind of got hooked on it. I got hooked on it because they were just like, dude, you need to like just kind of chill out. You're going, you know, too hard because you don't really know what you're doing, but you're trying and you're doing a really good job, but you need to learn this. And I just realized I didn't know, because I was like everybody else when they're for day one. Everybody's like that, right? You're just helpless.
Yeah.
And you learn, you're like, oh my God, I'm so helpless. And then you either are like, this is not for me, or you're like, I have to get better at this.
Right.
That's it. Like you're on day one, and no matter how good you are at anything else, you might be pretty good at like defending yourself if you're really strong and fast,
right?
You know, but that's not going to help you in the long run for jiu-jitsu.
Yeah.
So it's like, yeah, okay, that day, but you got 100 other days to go to this year, and then next year, and then next year, and next, you know, so it's like, it's that consistency.
Right.
So one thing that I learned from my brother's professor down in Long Beach, was that consistency is the most important thing. And he watched people come in, go, world champs come and go, you know, and then lazy guys become black belts because they are consistent.
Just keep showing up.
And it's not like that one guy that had a bad day. It's like, no, that guy's a black belt. Like it means a lot in jiu-jitsu to be a black belt.
Right.
Pretty much, if you're a legit black belt, you know, and it's that consistency, and you can apply that to so many things in your own life. That consistency, you show up, you go swimming every day,
right?
You get better. You play piano. I'm getting a lot better at piano because I've been playing a lot more piano, you know, or singing.
I know you've been doing a lot more music recently.
A lot more music, a lot more art, a lot more music.
I tried playing that drums.
Put it together.
Horrific.
Yeah, write some songs and do some art and stuff. No, it's fun, you know. But that's kind of just like fun. That's like, what do I really like to do creatively? You know, the podcast, putting like art stuff together. But that's that whole pocket. So that's kind of what I was talking about. Like, don't leave those realms, because one day they kind of pop, you know, and then now you got a podcast. You know, now you're producing a show, or maybe a couple shows. So what are we going to call our show? Is it going to be called the Dr. Stone and Sina Show? Is it going to be called the Mike and Sina Show? And
we're still deciding.
Well, we had the pilot. We had the pilot.
Yeah, the pilot.
And we need the actual pilot.
And then we need the actual pilot.
We're going to do the actual pilot
on PRP and BMAC Biologics. Stay tuned, guys.
Yeah, sure.
It's another exciting
That'll
episode.
Be the deep dive into that sciencey stuff. So this is the non-sciencey stuff.
This is the top level.
This is high level.
If you guys got bored by this, I hope you guys didn't, because the other one's going to be even more sciencey.
But I think it's going to be, I think what I'm interested is like a show for nerds. Yeah. That like cool stuff. You know, kind of like medical students. It's almost a show for medical students.
Right.
So it should be like high level information quickly that's correct, you know, or good sources. How do you find things?
Right.
Like what's a good tip? You have a lot of good tips.
Yeah.
Like Notebook, what's that one called?
There's
Notebook,
Notebook LLM.
Notebook LLM.
Yeah.
That was a good tip for me. I was like, I use this for certain things. It's a Google program where you use
it's AI. A Google program. You can aggregate, you can put on your sources all in one place.
Yeah.
And then you can interact with it, but instead of basically the idea is you are limiting the sources where the AI can pull out information from. So you
provide the sources.
Yeah,
right?
you're providing the sources yourself.
You put like 10 papers.
Yeah.
And then you say, okay, tell me everything about this topic based on these papers.
Yeah.
And that
So-
limits you.
Yeah,
That's
and it
really
limits you in a
nice
good way because
researchers, right?
you're not getting a lot of you're getting rid of all of the miscellaneous, irrelevant stuff out there, and you're really drawing your conclusions on the data that you would do normally if you would have to, like how I would do research when I was in college. So that's a really good. That's one of the many applications that you can use, and I really think it needs to be going back on like what we wanted our show to be about. I really felt a need for a podcast that provided information that was correct, but also that was scientific. Because a lot of the stuff that I see, I mean, I'm like I don't want to call myself an athlete, but I'm like a sports enthusiast and I like to stay healthy.
Yeah.
And when I'm like looking up all these information,
You're
and
definitely
all
an
these-
athlete.
Try my best.
No, you are.
Yeah.
Well, what sports did you play?
I played water polo when I was in high school. I
Yeah.
played rugby in college.
I thought so.
And then now jiu-jitsu. But there's this lack of the scientific approach to the information when it comes to kinesiology and when it comes to our health
Yeah.
and when it comes to sports.
We're going to highlight those things,
Yeah.
break them down.
We really wanted to
concise.
highlight those things. It's like if you really want to know how nutrition works,
Yeah.
we can break that down. If you want to know how these other therapeutic pathways work in terms of accelerated healing, we want to look at and give you the truth, because one of the beauties of this is that we don't have to answer to anyone. We don't have to bias it to anybody else. We really look at it. If it works, then we don't even say it works. Is that this study suggests that it works.
I mean, I've had people on my show that I changed my practice based on.
Right.
Because I look up the studies,
Yeah.
and so I mean, if it's correct, then it's just something I didn't know, and there's a
Exactly.
lot of things that we just don't know, or we might make decisions on in medicine that are cutting edge. It just means that things are right there. We're making
Right.
movements to make things better, and so that's why when we talk about peptides, like the safety thing is so important. And so with safety is safety comes first with any new treatment,
Right.
because I'm doing shoulder replacements for 12 years now at this point, throughout my training
Right.
and my career. And it's because they work, but I might change to a different system that has a track record, but a
Right.
brand new system that's been tested, but it's still a brand new system. I've been part of those post-market surveillance studies where you're looking at how they're still doing, and they do fine, So in general, it depends on what you're looking at. Just because something is approved, it depends on how stringent that process is going to be and how relatively new it is too. There's some things like hip replacements that have been out for 30 years, 40 years. These things have been doing really, really well. So those are not shifting the needle on something that gives you 90, 95% outcomes to get 96. It's going to take a lot of change overall
Right.
to make that closer, to make that little difference. But if you have a difference of something that, either causes cancer or doesn't, it's like, well, then clearly avoid that. you
Yeah,
know?
that's an easy
It's
distinction.
like an easy distinction, But then there's these subtleties of like how you use it, when you can use it. And so I think, having the show on that level of evidence, high level of evidence, but in a concise way.
No, I mean, I think it makes a lot of sense to have that information from a lot of these different people because, as you mentioned,
30 minutes.
Yeah.
20, 30 minutes, quick, 1-2 topics.
The reason, like you mentioned in that example of does this cause cancer or promote cancer or not, that is, like you said, easy distinction. But by extension of that means you don't need as much data to decide that. Like, it's very clear. But when you are looking at something as subtle as from like 95% to 97%, you need exponentially more data. And what that means is that you need people that have been dedicating their careers to understanding whether that 2% does happen or not. And the beauty of this is that you can bring on that person who has spent that career of 10, 20 years studying this, and you can learn. And they can concise it down to 20 minutes, and that 20 minutes is worth that 10, 20 years of that person's experience.
Who's going to do that? Who you want to guess that have 20 years of experience?
No, I'm saying
No
the people
way.
that you bring on, that you talk to, like these experts that you bring on.
On this show?
Yeah.
Oh, well, yeah. That's why they're the experts. I gotta talk to them. It's too much to know. I can't know all that stuff. I don't have the time.
Yeah.
I gotta go color and draw and do art and stuff and produce this show. No way, man. No, I gotta talk to them for sure. But our show is gonna be just you and me, so we're gonna call it the Mike and Sina show.
Yes.
I think it sounds better.
Mike and Sina show.
Yeah.
We can do that.
Mike and Sina show.
I like that. We can do S squared med talks.
Nah, that sounds weird. That sounds weird.
I like Mike and Sina.
Maybe we'll call it Mike and Sina segments.
Mike and Sina segments.
Mike and Sina science segments.
I like that.
Mike and Sina science, because it's about science.
Yeah.
It is about science, right?
It is. Scientific based. Oh, exactly.
Well, let's call it that.
There you go.
All right, you heard it here first, folks. The Mike and Sina science segment on the LA Shoulder podcast. Yeah, no, we'll do it that way. And you know what I was thinking too is we'll put these segments out and we'll make it something accessible. Yeah, feel free, sir. Today is about you earned it. You took your MCAT. You took a test for almost sub 8 hours, and then you had to drive home, act normal, like you didn't just take an 8-hour test, and then figure out what you're gonna do the rest of the day. How much Rick and Morty can I watch?
Oh,
Thanks.
I love Rick and Morty.
Cheers.
Cheers to you, sir.
Each time this is poured, you must cheers to this glass. This is beautiful. This might
So smooth.
I mean, it might be the best tasting tequila I've ever had. I think so, actually. This añejo is this is the bee's knees. This one wins. I think you just won with this one. This one wins. All right, Mandala. This one is the winner right here. Añejo Dia de los Muertos Special Edition.
Beautiful.
So, the future is bright. The present is pretty cool. I like the present also. But what are your plans for the future? Like, what is your career that you see yourself doing? Like, what excites you about the future? Like, how do you see yourself? Let me rephrase that. How do you see yourself fitting in to our crazy ass future? The way that AI is going to change how we interface with each other, how we interface with technology, how we interface with information, because you're entering into the medical field. I've been doing this for a while, so the old guys are going to hang on to the way we've been doing things, but everything's going to change clearly. You're going to be in medical school. We don't even know where the world's going to be in a couple of years, right? So what year are you going to be in medical school from now? Maybe
2028, maybe?
2028?
Yeah.
And we're 6, so a couple of years from now.
2 years,
So you start medical school, you're learning. 4 years from there, it's 2032.
2032.
So you're starting a residency.
Mm-hmm. And then
2030.
6 years from there, 2036 or 2038.
Wow.
Then I'll be out.
So tell me about the future, Sina. What's the future like?
I think he just had an existential crisis on my behalf.
Yeah, dude. That's crazy. That's definitely the future, man. 2030. Okay, so in 2028, Sina is a doctor. 2032. No, we said 20. What did I say?
2028 is medical student.
Medical student. Yeah. So
2032 is doctor.
Okay, there we go. So 2028, you're in medical school. So you're high tech medical school, right?
I think it has a lot of ramifications in terms of like.
But where do your passions fit in to how you're going to develop the future? Our future. Do you see yourself as somebody who's going to be, helping mold what that is for healthcare, on your way? Or do you see that, yourself as being a part of whatever crazy future we have? Because I don't know. It's not going to be the same, clearly.
Yeah. Clearly, the change is coming. Which direction that change is going is up for prediction.
Yeah.
What I would say is that, my personality is that I'm like a visionary. I don't like to be affected by processes. I want to be the one directing those changes and, like you said, molding that structure. As you know, I also, but the audiences might not know, the listeners might not know, is I also have a minor in computer science.
Wow, you're so credentialed.
You're
also my computer programmer,
yeah.
my go-to IT guy.
Yeah. So I...
See, the thing is, when you start listing all those credentials, people are going to make you do stuff. You're going to be the
They're
IT
going
guy
to test
now.
me. It's like, are you actually? All right, figure this out.
You got to do it now. You got to figure it out. There's another problem for you to solve, Sina.
So to me, I don't really get scared of what's coming in terms of technological advancement. It excites me a lot. And like we have been working on our projects, on our research projects, is like you mentioned in this podcast, we are in the information age, and being able to not just consume information, but be able to take control of the information and be able to modulate it in a way that it produces effective, actionable insights. It's very important and exciting to me personally, especially as it relates to medicine. So I think the direction that we're going, it's going to be more documentation in terms of not just clinical research of what the outcomes are, but even in practice, in physicians, like how you've been recording your patients' outcomes and all of these different factors that you can decide. If we are able to utilize these ever-evolving technologies to be able to streamline and make it easier for the physicians to collect these data, I think that really helps us accelerate our discovery process and help us in evolving and in creating new therapies that can help our patients.
Evolving.
Yes.
Yeah, absolutely. And because if you're evolving with the systems, you're driving that change, even if it's to a micro degree. You're not changing the whole healthcare system. I was just giving a big perspective, but you don't have to be.
Right.
You can have a smaller perspective. You can develop, a program, maybe that helps doctors that want to look at their data, know, and whenever you have people that are doing a lot of work, we're busy people, right?
Yes.
And so whenever you have people that need to look at what's going on, how do I account for it? You have accountants. Accountants account for your finances, right? Oh my God, I can't log into my IT. I need my IT guy,
right?
So how do I look at my data? We have our research assistants.
Right.
So in the technology age, it's almost ridiculous to not know where you are in terms of your clinical outcomes, what you're treating, and so
it's unoptimized.
You're
leaving that on the table.
It's there, it's all there, and we know, but it's like, how quickly can you get it?
Right.
Because it's all there.
That's the thing. And tying it all back in terms of like, how do you add value to someone? What I've noticed with, being a part of, having the privilege of being part of your crew, and also in my previous experience with other physicians, is that physicians are very busy individuals. And that's just not to say something to like flex or like just to say it. I understand like everybody is busy.
The world is busy these days, man.
But
like you're living a busy life, and then you're a busy doctor living a busy practice, and then you go home to a busy life. You're just always busy. So,
yeah, exactly.
But then, everybody's busy. It's a busy world these days.
No, 100%. And the point being is that when you have a physician that's treating patients and has the weight of his decisions on his shoulders, being, his decisions determine to a certain degree the health outcomes of his patients, he does not have time nor the mental effort left to be able to look at all of this extra infrastructure to add on in terms of collecting data. So what AI and the technology advancements come in to help is being able to streamline this in terms of, if before it cost X amount of dollars and X amount of efforts and X amount of people to be able to help Dr. Stone collect his data.
Right.
Now you can use data. You can use data. You can use AI with this streamlined infrastructure with a fraction of the cost and a fraction of people overlooking it.
Right.
So that it can concurrently collect all of this data.
Right.
So it doesn't add more load to the physician's already responsibilities.
Exactly.
It's another tool that can help them.
But why wouldn't you want that? You know,
Yeah.
you need stuff like that. But you know, if you don't think it's important, you're not going to do it. Of course,
Right.
those tools are there. You know, but you got to spend the time and go do it, or you got to, even if it doesn't cost money, you got to say why. So you have to have access to it. You got to know it's reliable. You got to know it's something that's HIPAA compliant. All those things. And so if there's not something, you know, you got to do whatever you can to have that data. It might be really hard for you. So you either do it your own way, or you know, you have to automate it. So.
Right.
The thing about AI and technology is it's there, but if you're not engaging with it, it doesn't help you at all. You know, so all of it is dependent on what the question is,
Right.
and then how you interact with that technology to get the answer that you're looking for. So a tool, you know, AI is just a tool.
Yeah.
For now. It seems to be, but
I think it will stay to be.
Well, I hope it does.
Yeah.
It should just stay that way. A human tool and just stay that way. So, you know, we're monkeys with a very complex wrench that we're holding that does a lot of different things, and it looks like a wrench, but it does a lot of different things.
Yes.
You know, that's like maybe infinite potentially, but you still have to engage with it and ask it the right question to get the response. So, you know, as you go through this, it's going to be a very different world going through medical school with AI, ChatGPT, you know, right? You know, I can't imagine what it's like to be in college right now.
Right.
You know, it's just like learning what's on because you can just type it in. What's the question, you know, as you're studying. And that's what I would do.
That's what I did when I was studying for that.
It would help me learn.
Yeah.
It helps, you know, if my objective is learning, I mean, that's pretty much the most valuable learning tool.
Right.
Seems to be is large language models, right? Because that's the internet in a more condensable way to get
exactly.
your
It's
answers.
it's an example of how like internet helped people accelerate their learning time compared to going to the library.
Exactly. And you might still need to go to the library if you like that, but then you also use it as a tool. But with regards to you know, how you engage with technology, it almost becomes a complex task because you still have the same tasks you have to do. Oh, I'm going to organize my calendar. I'm going to use AI to do that. I'm going to organize, you know, my paper and my presentation next week. I'm going to use AI to do that. You know, so you still have all these you know, voids to fill where you can still use that as a tool. Do you find that that's going to be something that changes how you practice? Like, obviously, going to be how you practice medicine one day, but like, do you find that that's going to be something that is going to be important to associate yourself with deeply,
right?
As a doctor in the like now.
I think,
and in the future,
I think the answer for now it's no, because like you said, I'm also like, I use it as an auxiliary tool. I don't use it as a main mediator. You know, I use it when I hit a roadblock and I think it could be helpful. So as of now, complete, definite no. What I will say,
you're talking about AI,
okay. Use of like chatbots and like all these different programs that like help you automate different stuff. So I only use it on very complex things because I look at it in terms of cost benefit analysis, and what I mean by that is how much time am I gonna spend learning how to use this AI? How much time am I gonna spend trying to integrate this AI with this task that I'm trying to get? And then on the other side of it, how much time will I save in the long run? And for a lot of things, the answer to that is, you know, going off of the hype wagon is no. You know, it's for me, it's much easier to visualize and write it out by my hand, you know. But for other reasons, like automating our data outcomes, like we've been doing with your practice, is okay. Yeah, it makes sense. I'm gonna spend a month, 3 months trying to develop this program because it's gonna save us a lot of money and a lot of time. So the question becomes is it going to be cost beneficial in terms of time for you using that AI? And obviously I cannot definitively say that in the future, but what I will say is that I've truly believed that all systems eventually reach equilibrium, meaning that once this AI has been introduced and integrated and accepted into human society, we will find, given 5, 10, 15 years, what it's best use and then what we don't use it. So in that sense, it's going to be like when I'm a doctor, I'm going to, just like how right now physicians will look at what's the most efficient EMR system to use. What's the most efficient systems of running a clinic, and you just use that.
It's almost like you have to be an expert at accessing data.
Yes.
That's almost what doctors are going to become, is experts at accessing that data and making the right decision, because we're decision makers based on the data that we have. And a lot of it's in our head as we're going through it. Like, you don't see me on ChatGPT all day
Right.
asking how to treat my patients, because I know how to treat them to get them better. But utilizing these tools for research, that's where I saw giant value. It's like conducting research, building tables, putting large amounts of complex data together in a simple way, summarize it in 2 sentences that I can understand this giant amount of data. So that's really cool for that. So as a researcher, I find it as a very valuable and useful tool. But it still has its limits, because it's limited based on us, and that's really what like treating our patients is about. It's really like what our limits are, and we might have the right answer, but still, it's what are we limited by? You still have to go through surgery, or you might have to go through this treatment, or you might have to do therapy for this amount of time for it to get better. It's just, that's what it is, and
Right.
and the more information you have that you can apply it with that precision medicine idea, really optimizing, like what is your status, like getting a status report on a person, and then figuring out what the deficiencies are, to optimize that person.
Right.
So I get it. I understand why there's a whole podcast just on human health optimization, because we're so complex every day.
Right.
You really have to be on top of these things really every day, and then every week, every year, and then things change over time. So it's in the information age, like, we as doctors become the gatekeepers and the key holders to how all that giant cloud of information and knowledge is then utilized in that particular instance.
Right.
So like, that's why doctors are still important, even
I think
with all
they will continue to be.
Yeah, I hope so. Because as long as humans are important, doctors are the ones that care about humans.
And even in terms of
treat them.
AI, I think the more I'm like looking into trying to learn how to utilize AI and how to kind of look under the hood of not just using AI, of like how to build my own and how to train it for my independent projects that I'm like interested in.
Yeah.
The more I understand that we as humans and as physicians are the ultimate decision makers, and because of that, AI will never replace that human. It would only become a tool, and at most it will become an integral tool, like how you use X-rays in somebody's practice. If you take X-rays away from somebody, from an orthopedic physician, it's going to be hard, but it's not going to stop them. Like the X-ray imaging does not make that physician.
Right.
There's a lot of different tools.
Well, I'm not too worried about the machines themselves going out of control and starting to make decisions. But I am worried about how people use that knowledge and information, and so I think credentials remain important, and so like coming to doctors for information to really synthesize it in a useful way, that's where we become, where we maintain our value, at least so far, because you can look it up. You can definitely look it up, put in all the symptoms, and it'll give you the answer. And then you have to differentiate if it's appropriate or not. Most of the time it is, because they're pretty accurate. But like that, I think understanding that role of, where, like, of the importance of the interaction, it still comes down to the patient, the person with a problem, and the doctor trying to get them better. And then everything else is just kind of noise around that.
Right.
So it's like, how is the doctor getting his knowledge and information and then applying it in the right way? And so like using these technologies like as a tool, continuing to use them to build research, to then use those programs to then write programs that you can use to maintain your data, I think is really, really interesting concept, because we have so many in these complex lives that we live, these like busy lives, you know, as people, and then as doctors or as other professionals, you need to have like a go-to. So it's like, okay, I need to access this. Where do I find it? I need to go here, and it's all on your phone. It's right there, right?
Yeah.
Or it's all connected now. But you know, I have my whole like paper notes, and those are like my special notes,
Right.
you know, because they're not on my digital work
Right.
stuff. And then I have like my work notes. So I find that using something like keeping it in an accessible way, having your data available. So, okay, I'm doing research on this topic. I can access it. Oh, I have a question about this. I don't remember off the top of my head, but I can access it. That's how like that interface with technology becomes, I think, really important in the information age. Because as humans, we get limited. We're not, you know, we can't process things so fast. We're pretty much one at a time. You got to focus on it. You can't do two things at once. You can,
Exactly.
you know, 'cause it's like basic things you can, but you can't focus on two things right at the same time.
No,
with
100%.
high intensity.
I think with this, I remember reading up on this, and nothing scientific, just like out of like a very independent article. It's in terms of the speed that, this is funny because this is like before the age of AI, is the speed in which we can pull up information to compare to the speed that we can process the information, and we are really reaching that upper limit of. Now we're able to pull up information faster than we can process it,
right?
You know, because it still needs to go through that visual pathway of like, you need to read it, and then it needs to register, and then you need to comprehend it. Versus, I think the next step would be to integrate that AI interface, that it just directly goes to your cortex and you understand it.
Yeah,
now,
that's the neural link stuff, right?
Yeah, that's the neural link stuff that you pretty much beat the gap between the time it takes to process it to the time it takes to pull up the information, you know. So that really is what's becoming the limiting factor at this point, because like you said, I can search up anything, I can look up anything, you know, like
those are cyborgs.
Yeah,
I mean, those are human cyborgs. If you know, when that really becomes a widespread thing. Yeah. But that'll be tough to compete with when you can't access, when you can't interface with the information as fast. So yeah,
but that's
cyborg doctors.
Yeah,
maybe
that's cyborg stuff.
Yeah, cyborg doctors.
Maybe I'll get a chip. Who knows?
Do you want to go to Harvard? You must be chipped. You must receive the Harvard chip. Do they talk like that at Harvard? I've never been there. Do they say Harvard?
Some of them, the ones from Park the Car at Harvard Yard. Yeah, they do talk. Some the Bostonians.
You play rugby at Harvard. Nothing bad about.
Have you watched Agatha? Is that what it's called? No, Gattaca.
Oh yeah, definitely.
We're reaching those
about the human genome, right?
Yeah. The GMO people trying to go to Mars, and then the guy is. I won't spoil it. The 60-year-old movie.
It's an old movie. You can spoil it. It's really old. But dude, it's been great talking to you. I think this is hopefully going to be helpful for a lot of young burgeoning medical students, people going into medicine. I think it's still a great field. I think being an orthopedic surgeon is awesome. I really think it's great. You know, we help people. I help people. They're very thankful. They're happy. They bring you tequila. So go into orthopedic surgery, kids, because they bring you tequila.
Very nice.
Highly recommended.
Sina approved.
But no, it's been great having you. I think the Mike and Sina science segment is going to be a really fun addition where we can really dive into some more deep topics. I wanted to have you as a guest on my show. I thought that was important, to really find out who Sina is. Who is this guy? Now that you took your MCAT,
right?
And so I'm going to have you back on once you're in medical school. So then he's going to be totally different. You're going to be totally different when you're in medical school because you're going to be way more relaxed,
right?
Except you're going to be studying for your test. So we're going to do a 30-minute show and you're going to be out of here. And then you're going to come back again when you're a practicing surgeon. And then we're going to have a fun show. So
absolutely.
More tequila to come, sir.
Yes, sir. It has been a pleasure.
Thank you
so
so much
for
having
me. Thank you.
Sorry for talking while you're trying to
close out.
Well, thanks for coming on, buddy.
Thank you so
much.
All right, buddy.
I'll see you again soon. That's all, folks, on the LA Shoulder Podcast.